Good evening. Today is July 16th, and today I'll continue to be talking about the virus. So the first piece of news that I'd like to talk about is that researchers reported strong evidence that the coronavirus can be transmitted from a pregnant woman to a fetus. A baby born in a Paris hospital in March to a mother with COVID-19 tested positive for the virus and developed symptoms of inflammation in his brain. According to Dr. Daniel DeLuca, who led the research team and is chief of the Division of Pediatrics and Neonatal Critical Care at Paris-Saclay University Hospitals, the baby, now more than 3 months old, recovered without treatment and is very much improved, almost clinically normal. The mother, who needed oxygen during the delivery, is healthy. The virus appeared to have been transmitted through the placenta of the 23-year-old mother. Since the pandemic began, there has been isolated cases of newborns who have tested positive for the coronavirus, but there has not been enough evidence to rule out the possibility that the infants became infected by the mother after they were born. Now, this just provides convincing evidence that the transmission of the virus during pregnancy can occur. In the Paris case, Dr. DeLuca said that the team was able to test the placenta, amniotic fluid, cord blood, and the mother's and baby's bloods. The testing indicated that the virus reaches the placenta and replicates there. It can then be transmitted to a fetus, which can get infected and have symptoms similar to adult COVID-19 patients. A study of this case was published on Tuesday in the journal Nature Communications. The relatively high levels of the coronavirus found in the placenta and the rising levels of virus in the baby and the evidence of placenta inflammation, along with the baby's symptoms, all consistent with SARS-CoV-2 infection. The doctors in Paris have said that the woman was 35 weeks pregnant when she came to the hospital with the fever and a cough that she developed a couple days earlier in what was an otherwise healthy pregnancy. She tested positive for the coronavirus, and after 3 days, the baby was delivered by emergency cesarean section. The baby was connected to a ventilator for about 6 hours, and he seemed to be doing well, but on his third day, he became irritable, had trouble feeding, and was experiencing muscle spasms and rigidity. A brain scan showed some injury to the white matter, which resembled symptoms of meningitis or inflammation in the brain. He tested negative for other viruses or bacterial infections that could have caused such symptoms, while tests of his blood and fluid from his lungs were positive for coronavirus infection. The highest levels of the coronavirus were found in the placenta, and this shows that the virus was able to replicate in placenta cells. So I think this just provides convincing evidence that we know that pregnant mothers need to be extremely try to stay safe as possible, and they need to be extra careful as well. The second thing that I'd like to talk about is that there's recently been stories about doctors who've said their patients were reinfected with coronavirus after testing negative, a worrying prospect that could impact the effectiveness of vaccines and our ability to reach herd immunity. While the question of how long does immunity last is unknown, the only way to know how long immunity lasts is to wait that amount of time. And I think there have been studies which have shown that antibodies probably disappear in a few months, and this could provide a challenge for vaccines as well, because if vaccines produce antibodies and those antibodies didn't disappear, then the vaccine could be ineffective after a few months. A reinfection is probably real, as it is possible to get COVID twice, and that's also possible for any virus. Some people will not make strong immune responses to a virus, so they remain vulnerable, and this is also probably true for the coronavirus. If reinfection is possible just after the virus has been circulating almost 8 months now, then we're going to probably hear a lot of more possible reinfections because it's affecting so many people and we're looking at it so closely. I think there are the reported cases of reinfection is definitely true, and this could be someone who thought they had recovered or may not have fully recovered. And it could also be that their immune system was keeping the virus down to levels at which the test wasn't picking it up for a while, and the virus could resurge again, and the patient could again test positive. There are just a lot of possible explanations for the reported case of reinfection, but I think overall this just adds to the case that we need to stay socially distant and stay as safe as possible. That's it. Thank you for listening, and I hope you have a good day. Thank you.